We are the AfriChild Centre, a catalyst for change, championing the localization agenda to ensure that solutions for children's well-being are shaped by those who understand the challenges firsthand. Through African-led research, we elevate local voices, prioritize homegrown solutions, and disrupt traditional power dynamics in knowledge production. Our dedication to the decolonization of research moves beyond extractive models, fostering equitable partnerships that empower African researchers and institutions to lead the generation of evidence that drives impactful policies and transformative action. At the AfriChild Centre, we are committed to creating a world where every child thrives. Our work is built on 3 pillars. 1. Generating research evidence. 2. Driving research into policy and practice. 3. Strengthening organizational capacity. In 2024, the AfriChild Centre expanded its footprint, driving impactful research and interventions for vulnerable children. From piloting school social work in Gulu to empowering clan leaders in violence prevention, our work is shaping safer communities. In Karamoja, we are assessing school-based violence, while in refugee settlements, projects like Obumwe 2.0 and Kulea Watoto are transforming early childhood development through arts, psychosocial support, and innovative learning models. The AfriChild Centre continues to conduct high-quality, rigorous research that has utility for policy and practice, and at the same time amplifies the voices and lived experiences of children. We partnered with the remnant generation to evaluate impact of the 3RT model, a transformative approach to restoring hope and dignity for vulnerable girls.
The Remnant Generation is an organization that serves girls and children that are survivors of sexual abuse and teen mothers in Uganda. The experience has been transforming. I had the opportunity to be with the AfriChild team at the Sexual Violence Research Institute conference last year. It has been exposure with different actors in different spaces of child protection, and we are appreciating the capacity building, exposure, and just knowledge exchange that we are acquiring as a result of working together with AfriChild.
In 2024, AfriChild joined forces with 11 universities across Uganda, the region, and the continent, while forging 15 new partnerships with institutions committed to evidence-driven solutions for Africa's children. We sealed a landmark tripartite partnership with Uganda's Ministry of Health and Washington University's International Center for Child Health and Development, paving the way for groundbreaking research and interventions in malnutrition, mental health, and child development. New agreements with Islamic University in Uganda, IUIU, and Mbara University of Science and Technology, MUST, expand our research reach, tackling child health, protection, and education challenges through knowledge exchange and training. The center established a partnership with Now and Tomorrow, a refugee-led community-based organization fostering resilience and promoting self-sustainability among refugees in Nachivale refugee settlement in Uganda, and Ethiopia's Refugees and Returnees Services RRS to drive research that informs policies and strengthens early childhood development in refugee communities. AfriChild remains Uganda's country partner for the International Society for the Prevention of Child Abuse and Neglect, ISPCAN, a leading global network dedicated to child protection. Under regional positioning, the center strengthened its regional and continental influence in child well-being advocacy and research. Gaining observer status at the African Union marked a significant milestone, enhancing our engagement in policy discussions at the highest levels. We actively participated in key regional and continental forums, including the Eastern and Southern African Regional ECD Conference, the 43rd Ordinary Session of the African Committee of the Experts on the Rights and Welfare of the Child. AfriChild also played a leading role in co-hosting the continental commemoration of the Day of the African Child and contributed to critical convenings such as the annual learning event on preventing violence against children and the East African Learning Initiative's Team Leaders Convening. In collaboration with the Ministry of Gender, Labour and Social Development, academia, international partners, and civil society organizations, AfriChild was at the center of the formulation of the multi-sectoral Child Wellbeing Research Uptake Forum to facilitate cross-sharing of information among policymakers, practitioners, and researchers. The Multi-Sectoral Child Wellbeing Research Uptake Forum aligns with Uganda's National Child Policy 2020 and Vision 2040. AfriChild staff joined the Capacity Building for Leadership Impact CBLI program, gaining critical skills to steer our mission forward. In 2024, the AfriChild Centre actively engaged in both national and international platforms to disseminate research and advocate for child well-being. Nationally, we contributed to key policy discussions, working groups, and parliamentary forums to influence child-sensitive budgeting and early childhood development policies. Internationally, our work was showcased at major global conferences and published in leading academic journals, ensuring our research reached a wide audience of policymakers, practitioners, and scholars. Under systems strengthening, the AfriChild Centre improved its IT infrastructure to enhance efficiency, security, and data management. Our resource mobilization strategy generated new funds to support interventions, and these are some of our projects acquired in 2024. None of this would be achievable without the unwavering support of our dedicated board members, generous funders, and valued partners. We are deeply grateful to the communities that have embraced our work and to the children whose resilience continues to drive our mission. The AfriChild Centre, transforming child welfare through research and action.